Hi there, I'm Michael Sams here at Sam's Hockaday. Very excited to share one of the most challenging parts about going on to Medicare and navigating the Medicare maze. One of the things that I'm going to be sharing with is how to run your own Medicare Part D comparison and why it is so important to do so. In my humble opinion, there is only one way to run a Part D comparison correctly, and that is to utilize Medicare's website. I'm going to help you navigate through Medicare's website to show you how easy it really is to run your own comparison from your own computer. One of the things that I want to highlight is the fact that many people receive flyers in the mail either as they're soon to be on Medicare or during the annual open enrollment period between October 15th and December 7th. And they have this beautiful looking flyer in their hands and they want to select a plan based off of this good looking flyer. Premium looks affordable, deductibles in line. I think that they're going to cover all my drugs because they either did last year or it looks like they've got a pretty broad formulary. And we can't just blindly pick a drug plan, Medicare Part D drug plan, based off of this flyer that you've received in the mail. So we're going to go ahead and dive right into Medicare's website, which is medicare.gov. We can really just break it down into 4 easy steps. Number 1, we go to medicare.gov. Number 2, we enter in your zip code. Number 3, you enter in your prescription medications that you take. And number 4, you enter in your pharmacy. And when you add in those things, it will automatically calculate all of your options for Medicare Part D in order according to cost. A common problem that I run into is people talk to friends, family, and neighbors, and they offer advice on what plan is the best, what company has the best plan. And they may say, they may say company XYZ is the best. And you know what? It might be for them and the drugs that they take. But if you're not taking the same drugs and you're not going to the same pharmacy, then you can't just follow your friend, family, or neighbor's advice. So here we go. Medicare.gov is the first place we're going to begin. And as soon as we get there, we get to click on this green button that says Find Health and Drug Plans. Once we click on Find Health and Drug Plans, it's going to take us to the next screen. This is where we enter in our zip code under a basic search. For myself, it goes like so. And we click Find Plans. When we get to the next step is something that we are allowed to do a very specific search or a general search. And I just want to skip this first step by saying, I don't know and I don't know. We do not have to have these particulars in order to get to what we're hoping to accomplish. When we get to the final part here, would you like to add drugs? We will say yes. This is very easy. I don't know, and yes, I would like to add drugs, and I get to click Continue to Plan Results. I'm going to use 3 prescription medications that are rather common that you may see some similarities to your drug list. First one goes like this. I want to add in my first drug. I'm adding in 3 total. It goes like this. As you start typing the name of the drug, it will automatically pop up other drugs that follow that same spelling. You want to determine the dosage that you take and the frequency. How many pills? If I take 1 a day, that's 30 pills per month, and this all works out well, and I get it from a retail pharmacy. Every drug comparison or every option on the drug comparison is going to give you the mail order option. So we don't necessarily have to click this button. We can just leave it as retail pharmacy. Again, I'm going to add 2 more drugs. And as you see, my drug list has lisinopril added on there. I'm going to click in the box again, add in my next one, starting simvastatin, and we're going to click on it. I'm taking, let's make it up and say 10 milligrams. And let's say I take 2 pills a day and the quantity would be changed to 60 pills every month. If I'm getting these on a 90-day supply, fine. That's no problem. We can just for the sake of just getting the numbers, it's okay to leave it as every month I'm getting 60 pills. That's 2 pills a day. Add drug and dosage. And the final one we'll throw in there will be this drug here. Let's just say that milligrams is exactly what I'm on, and I'm taking, let's say, 3 of these a day. I don't even know if this is realistic on the quantity, but we'll just say that it is. Every month, I'm taking 90 pills. That's 3 pills a day. And I get to add drug and dosage. After your drug list is complete and you see all of your medications here, you have the option to change the dosage if you happen to look at your bottle and find out you're taking a different dose. Or, you know what, I was on that, but my doctor took me off of it, and you can hit remove. But let's say these are your medications and you want to say my drug list is complete. The next step we're going to be looking at is choosing your pharmacy. This is extremely important. Let's just make it up and say that you're currently using Walgreens, but you wonder how the cost compares to Walmart. You can add 2 pharmacies at a time, and that's all that you can add. And let's just say that your pharmacy is not showing up on this list. You can broaden your search right here and say that we found 8 pharmacies within a mile of my zip code. I can broaden that search and say that I want to look at 20 miles, within 20 miles of my zip code, and there's going to be a lot more pharmacies to choose from. But right now we're dealing with Walgreens and Walmart, and we're going to say continue to plan results. That orange button is at the top here, but it also is going to be the final step. I want to look at prescription drug plans with original Medicare. I'm going to check that box. It tells me there's 27 plans available, and I'm going to say continue to plan results. Now here is the cool thing. All 27 plans are in order according to cost. I have to scroll down past original Medicare and get to the part where it says prescription drug plans, and it says 27 plans were found in my zip code. I'm viewing the top 10. If I want to view all of them, I may want to say that I want to view all because I see this as my number 1 choice and call it Silver Script, but I want to know how that compares to the plan that I'm on now. So I can click the box of the number 1 choice, and let's just say that I'm on a prescription plan called AARP, and I want to click on it. Now that I've selected 2 plans, I can select up to 3, but now that I've selected 2 plans, I can scroll to the top or the bottom and hit the orange button again. When I do that, it's going to lay these plans side by side, allowing me to see them at the same time. On the left, I have Silver Script Choice. On the right, I have AARP Preferred Plan. I see the difference in the premium, $26.80 versus $69.20. I see that neither one of them have an annual drug deductible. I see a significant difference in the cost when they estimate the total cost on the year, including your premiums for the whole year, your co-payments for your prescriptions for the whole year, and a deductible if your plan has one. As we're looking at Walmart, Walgreens under Silver Script plan versus Walgreens, Walmart under AARP's plan, you will see that the biggest cost savings is going to come in either Walmart or Walgreens under the Silver Script Choice plan. There's a big difference between $1,400 and $1,900. So what I'm going to do now is I'm going to narrow in on my number 1 plan. It saves me $500 from where I am now. We're assuming that this is the plan that I'm on now. And so I'm going to hover over the name and I'm going to click on the name. As we click on the name, it gives us the breakdown of the individual prescription cost, starting with a monthly drug plan premium being $26.80 a month, showing that the annual drug deductible is 0, showing me that Walgreens versus Walmart, there's no difference in the price. Many times there's a savings to choose to do the mail order. In this scenario, there's no savings. There's no incentive to do the mail order. As we scroll down a little bit farther, I get to see my 3 prescription medications, and it shows me the full cost of the drug. I'm looking at Walgreens, but I could slide over to this tab and click on Walmart. And then again, I can click on mail order if I want to know what the cost will be. For the sake of just continuing with this example, you'll see Walgreens. The full cost of the drug is here. If I have no insurance at all, my premium is, my monthly cost is $717. But through the plan, my monthly cost in co-payments is going to be totaling $54. Okay, so that is probably the quickest, easiest way to give an overview of a Medicare Part D plan and how to navigate. I think it's very easy. I'm going to back up a few steps. I think it's very easy to go through entering your zip code, entering in your medications, entering in your pharmacy, and getting to the plan results. But what happens when people get to the plan results, we get to this page here, it says, holy cow, I'm at 27 plans. How do I know which one's the best? Your number one option that's going to save you the most money is always going to be the first one. So I can err on the side of saying, hey, SilverScript is my number one. I'm just going to go ahead and dive into the details by clicking on the plan name. But after I've selected that plan and I've navigated my co-pays and know that it's going to work for me, I can simply hit this enroll button right here, enter in my name, date of birth, social, address, all that information, and I'm going to be enrolled directly in that plan in about 3 minutes. It's very quick, very clean, very easy. The only other time that you would really select anything other than your top choice is if you said, you know what, I'm already on Aetna. And the difference between SilverScript and Aetna on the entire year is a couple $100. Let's call that $15 to $20 a month savings to go with SilverScript. Well, you know what? For $15, I may not want to change. $15 a month savings, I may not want to change. And in that case, leave it alone. My rule of thumb is if you can't save at least $200, $250 on the year, it's probably not worth the hassle of changing to another plan. But if you find, I'll wrap us up with this, if you find that you're on a plan that's down here, not in your top 4, not in your top 5, we probably want to go ahead and select a new plan for the new year. Once again, clicking on the name of the plan, navigating the co-pays to be aware of what you will pay for your prescriptions, and you can simply hit this enroll button right here, which will take you to the enrollment screen. I hope this is helpful. We want to be a huge support and a huge backup for you, but I'm encouraging you to go ahead and go to Medicare.gov, navigate these steps that we have shown you, and if you have questions, feel free to reach out. We'll be glad to help. Have a great day.